Hello, we have already dealt with the symptoms of heart failure in another video, but today I want to discuss something called the Framingham criteria. And this is a modified Framingham criteria where we have the symptoms, and based on the symptoms of heart failure we can diagnose heart failure by dividing the symptoms into two main groups. We have the major symptoms, which are the most important, and we have minor symptoms, which are also important but not so important. Therefore, if we want to diagnose heart failure, we need to have two major symptoms or only one major with two minor ones. So two majors or one major with two minors. That is the modified Framingham criteria to diagnose heart failure based on symptoms of these two groups of symptoms. And which are the two groups? The major ones are, for example, the patient comes in and complains about nocturnal dyspnea. This is called paroxysmal nocturnal dyspnea, which means that he is having problems with the breathing in the night. And this just appears in the night. Nocturnal means night. And also he is complaining of when he's lying down in bed, he is having problems with breathing. So it comes in the night and it comes when he's lying down in the bed. Also, when we examine the patient, we go there and we auscultate, for example, the heart. We hear third heart sounds, gallop rhythm. Sounds like a horse, it's galloping when you listen to the heart. Or when we auscultate with the stethoscope the lungs, we hear pulmonary rales. Or when we check the venous pressure here in the jugular veins, we see an elevated jugular venous pressure. These are the three things that we can immediately look at when we look at the patient. Elevated jugular venous pressure, we auscultate the lungs, we hear pulmonary rales, and we auscultate the heart, we hear third heart sounds. The patient's anamnesis, as we said, is when we ask him what kind of symptoms do we have. He has problems with breathing in the night, so paroxysmal nocturnal dyspnea, or he is having problems with breathing when he's lying down. These are the two things that you take from anamnesis. Three things that you take from physical examination, as we said, elevated jugular venous pressure, pulmonary rales, and third heart sounds. Then we go on and we make a chest x-ray. And in the chest x-ray we will see that the heart is enlarged. That is called cardiomegaly. Or we can see that we have lung edema, so pulmonary edema on chest x-ray. So these are the two things that we will see on the chest x-ray. Good. And the last thing that we can ask is, did the patient lose any weight? So if he lost more than 4.5 or more than 5 kilogram in less than 5 days, by, for example, by a treatment against heart failure. So, for example, if we suspect that the patient has heart failure and we start to treat the heart failure with some medications against it, and we see that the patient drop more than 4.5 kilograms in 5 days, then it's also a major sign in this Framingham criteria. So let's recap the Framingham criteria of the major ones. We have eight things. Two things that you get from the anamnesis. Orthopnea by lying down, which means that this, he has problem with breathing lying down. Paroxysmal nocturnal dyspnea, problems in the night. So you have difficulty breathing in the night. These are two things. Then comes three physical examinations. We have pulmonary rales, we have third heart sounds, so gallop rhythm, and we have elevated jugular venous pressure. These are the three things. Then we get chest x-ray, two things. We have cardiomegaly, which increased the heart, and pulmonary edema. And then the last thing, the eighth criteria, is that we lost more than 4.5 kilograms in 5 days. Good. Let's look at the minor ones. The minor ones are also, for example, something happens in the night. Not difficulty breathing, so not paroxysmal nocturnal dyspnea, but instead cough. Cough in the night. That's a minor one. That's not so severe as having dyspnea in the night. Also, we can have something called bilateral leg edema. So both your legs are swelled. It's a lot of fluid in both of your legs. This is also a typical sign of heart failure, but it's a minor criteria in this Framingham criteria. We have dyspnea on ordinary exertion. As you see, in the major one, we had paroxysmal nocturnal dyspnea, that is meaning dyspnea in the night. Here we have dyspnea by regular exercise or regular movement. Okay, that's a minor criteria. Then we have, instead of cardiomegaly, which was an increased heart, we have here an increased liver in minor criteria, increased liver. The other one is tachycardia. Tachycardia means that we have a pulse more than 100, but in this case it's more like more than 120 beats per minute. Okay, so remember, more than 120 beats per minute is tachycardia, and this is a minor sign. So let's recap. We need two major ones, or we need one major and two minors. The two majors should be from the list of major ones, which were 8 criteria. We had paroxysmal nocturnal dyspnea, we had then this orthopnea, which means that the problem with breathing by lying down, elevated jugular venous pressure, pulmonary rales when we auscultate, third heart sounds, or cardiomegaly on chest x-ray, or pulmonary edema on chest x-ray, or he has lost more than 4.5 kilograms in 5 days. The minor criteria, so if we have 2 of these, then we have a diagnosis of heart failure. Or if we have 1 of these together with these minor criteria that we said, bilateral leg edema, cough during night, dyspnea on regular exertion, hepatomegaly, which is an increased liver, or tachycardia, which is a beat of more than 120 beats per minute. Good. I think I repeated it enough so you can remember it. So I thank you very much for listening, and I see you next time.